restrictions.
Well, let's get more on this morning's top stories with the help of Georgia Gilholy, reporter for politics.co.uk and a commentator at Young Voices UK. A very good morning to you. Thanks for joining us bright and early on a Sunday morning. Look, the booster rollout is being viewed now as something of a national mission, isn't it? I think 3.5 million over 30s will now be able to access that booking system. Do you think that a booster bounce will be enough to get Boris out of peril?
Well, I think obviously when it comes to the actual virus, the booster jab is said to be very effective so far from what we know against the new variant and obviously, you know, the previous variants of COVID. So I think obviously that's the priority in terms of if it can sort of improve the public mood towards the government, including obviously the Prime Minister who's in hot water right now. I think it sort of remains to be seen. I think this incident, or multiple incidences rather, in terms of accusations of a number of parties happening at Downing Street during lockdown, I think people are very, very angry about this. You know, certain polls showed over half of the population actually already believed, this was days ago before this photo from the Mirror last night, believed that Johnson should resign over, you know, that already. So I think, you know, this is something that could be hanging around until the next election, I think definitely, especially sort of snowballing with everything else that's happened in the past few weeks with the sleaze scandal with Owen Paterson, some of the other accusations to do with pen farthing and possibly Carrie and the Prime Minister intervening on that. I think it's sort of snowballing into a lot of things, but these party allegations, I think they really hit home for a lot of people because many people sort of follow the rules very diligently, even at Christmas time last year, and they feel that whatever their opinions on lockdowns or Plan B or whatever is right now, they feel that it's totally hypocritical that they were forced to do this while ministers and aides, you know, we have footage of them joking about sort of breaking them. They clearly were not that bothered. So I think, you know, the booster jab rollout, it's really a victory of pharmacy and innovation. It's not necessarily a victory of, you know, the Department for Health.
Yeah, I mean, it's interesting, isn't it, though? I mean, as you list all the things which have happened over the past few weeks, there's no respite for the government, for the Prime Minister moving forward with, what, up to 60 Tory rebels expecting to go against Plan B in the vote on Tuesday, and never mind the talk of a possible Plan C moving forward.
Absolutely. The problem is, of course, we know that 60 isn't enough to defy the government because we know Labour are going to be voting for these restrictions. At the moment, I believe there are no Labour MPs who publicly said they vote against them. However, this is a very, very bad look, 60 if you're an MPs voting against restrictions. And I think that it's a sign of sort of future haranguing to come when it comes to restrictions within the Tory party at least. And this is not going to be helpful at the next election. It's really difficult to sort of think about what's going to happen if there is this level of dissatisfaction among the ranks of the Tory party when we get to that point. And that's not even think about the MPs, let's think about voters. We obviously don't have sort of watertight polling on this issue at the moment, and we don't know what's going to happen at the next election. But if the proportion of voters is higher who are dissatisfied about Plan B than it is the MPs, which I believe is probably possible, this is not a good sign for the next election, for the Tories anyway. Maybe for Keir Starmer it's a good sign.
And how the government handle this wave will be absolutely critical, won't it, to that election, whenever it may be. And as Stephen says, no respite. Not only is this vote happening on Tuesday with a huge long list of rebels, but there are already talks of a possible Plan C. Headlines this morning, really terrible reading, 25 to 75,000 deaths being predicted by the London School of Tropical Medicine if no additional measures are taken beyond Plan B.
Yeah, so the problem is when it comes to this is that when the government is trying to justify, you know, bringing in further restrictions, people want to sort of see the proof that this is justified. And I think right now, you know, the WHO, who obviously not necessarily been the most trustworthy organisation as of late. However, they and other sort of research organisations as well have estimated that Omicron is actually it's actually milder than many other variants of COVID we've dealt with previously. So I think sort of if that is the case, even though it spreads more rapidly, we're probably going to see things maybe happen over time that will be proportionate to what we've seen before, or less, of course, if people get the booster jabs, which are effective against Omicron so far, we believe. But it doesn't necessarily mean that, the effects are going to be disastrous in the long term. And I think that sort of the headlines this morning being possibly over dramatic and scaremongering just a little bit, because I think
there is a real problem here. There's a real problem here, Georgia, isn't there? In that the Prime Minister and the key players in government really are stuck between a rock and a hard place, aren't they? Because, as I say, people don't want to feel that there are more restrictions going on. You can understand that from a human perspective, absolutely. But if it is found by February next year that the government didn't take enough action to prevent even just several thousand deaths, I mean, this is even just, I mean, this is what we've got to, isn't it? But if the government doesn't take action to prevent deaths, then again, that's going to be a huge point of criticism.
Actually, I mean, I think if you look at the polling, people are actually generally more in favour of restrictions than you would think. So I think that the government it's less so, obviously people don't necessarily, like going into them, but people are generally, a lot of people, especially older people and younger people actually, are in favour of vaccine passports, they're in favour of masks, that kind of thing. So I think it's also a question of the government wanting to be seen to do something, because if they were in possession of figures that suggested, a real disaster when it comes to Omicron so far, I don't think that bringing in masks in shops and not in restaurants would make sense. I think that that's sort of what we have with Plan B is something quite piecemeal. So I think that if the government would have evidence that this is going to be an absolute disaster, I really think that, they would do more. So I think it's also, it's not necessarily a matter of a majority of people wanting to defy the rules. I think that it's people are confused, people don't know why, let's say, if, the future of Omicron is very bad, why we're only being told to do, very few things. But of course, people really don't want to go back to a tough lockdown, not seeing their families, that kind of thing.
Yeah, I mean, George, as you say, the vast majority of people are happy to go along with restrictions. One thing that's likely to be divisive, though, is vaccinations for primary school-age children. Sunday Times are leading on this story this morning. They're showing leaked documents from NHS England, which show healthcare staff have been told to start prepping for mass vaccination of 5 to 12-year-olds with parental consent. But this is bound to be highly emotive, isn't it?
Yeah, the problem for me, the questions that sort of come to me when I think about this idea is, of course, it's not harmful for children to be vaccinated. Obviously, from all the data we know, it would, if anything, possibly, probably be helpful. But is it necessary? I mean, the disease is it's very mild for most people who, are my age, I'm 23. For most people who are of any age who don't have any other co sort of issues coinciding with COVID. So I think it's not necessary. I think many people have made the point that, of course, we have, a huge stockpile of many of the vaccines. Would it not be more useful to send, these millions of doses we have to developing countries, for example, in the south of Africa, where we've seen Omicron arise, because there are poor vaccination rates, because many of those countries, Botswana, for example, have tried to get a hold of vaccines and they've just not simply been able to get them in great numbers up until, of course, Omicron has arisen, because the disease is more active there. So I think that, for me, thinking of sort of the balance globally, it would make more sense to do something like really streamlining our efforts to donate those doses abroad, because otherwise that will probably come back to bite us more than, say, leaving very, very young people not vaccinated, because the disease is mostly not dangerous to them anyway.
OK, look, got to leave it there. Good to talk to you this morning, Georgia. Thank you.
Great, thank you.